Welcome to Viable Environmental Monitoring, presented by me, Paul Yeatman. Welcome to my presentation / training on viable environmental monitoring. I'm Paul Yeatman, a microbiologist, team leader and quality assurance professional with over 15 years experience gained working in the microbiology laboratories of pharmaceutical companies in support of production. I analyse and improve the control processes of manufacturing companies, allowing them to release batches sooner in order for them to operate in an audit-ready state so they can reduce or eliminate their audit observations and release quality product, which ultimately saves them time and money. I can be found on LinkedIn, Twitter, and my microbiology blog, so be sure to check those sites out. That will give you more information on my skills and how these can help you. So, what is in this presentation for you? Microbiologists are directly involved in the collection of viable environmental monitoring samples from production rooms, support areas, and purified water systems. Often such work is carried out without a deeper understanding of why these samples are required and how the sampling sites were chosen. So this presentation aims to provide this understanding. Why is this training needed in a pharmaceutical or a manufacturing company? Well, microbiological monitoring is used to determine if the controlled environment being monitored is within an adequate state of control. It may also be used to confirm that cleaning and sanitation is effective and that personnel within the production environment are not carrying an unacceptable bioload. This is required information as it ensures that products produced are unadulterated and are fit for their intended purpose. This monitoring is an important indicator of the state of control of your production facility. This presentation aims to provide you with the following education. What viable environmental monitoring is and what it is used for. What the types of viable environmental monitoring are. A little bit on determining what to monitor if required to do so. I will explain what alert and action levels are used for. And I will also touch on why validating test methods is a good idea. Firstly, what is viable environmental monitoring, or VEM? Viable environmental monitoring is the monitoring of factors within a production environment that may have an impact on the quality of goods produced within that environment. So basically, is there an unacceptable level of contamination within that environment, or is contamination in, I guess, the wrong spot or a risky spot? Such factors may be the air, surfaces, product contact surfaces, the filled or pre-filled product, and also production operators. The method of monitoring tends to determine the sampling method. Why is viable environmental monitoring needed? Viable environmental monitoring is used to determine if the controlled environment being monitored is within an adequate state of microbiological control. Viable environmental monitoring may also be used to confirm that the cleaning and sanitation is effective and that personnel within the production environment are not carrying an unacceptable bioload. And this is required information as it ensures that the products produced are in an unadulterated state and are therefore fit for their intended purpose. So a product that has contaminants in it, so that's something not listed on the label, be that a strange chemical or a piece of glass or a microbe, then they're adulterated. And finally, viable environmental monitoring is an important indicator of the state of control of your production facility. So pretty much you do monitoring to determine the current state, and from that determine what the potential impact to the product is if you get a negative reading or a bad reading, and ultimately you get an idea of the state of the room. What are the types of viable environmental monitoring? Across the industry, there are several acceptable recovery methods. We have active air samplers. So here you can see a breakdown or an expanded picture of the components of a MAS 100 air sampler. There's passive air sampling, which is like active air sampler, but it just involves sticking a petri dish on a surface and allowing things to drop out of the air. We use contact or RODAC plates, and RODAC stands for Replicate Organism Detection and Counting. So back in the old days, that was what those plates were called. It's more likely to be called contact plates these days, but they are both referenced within the documentation, regulations and guidelines that you come across. We also have swabbing, which is like a big cotton bud. Print plates. So you can see an operator pressing their fingertips to a print plate and then their thumb. So one thing to consider when monitoring production facilities is the potential contamination risk of the actual people performing the task. And because people generally touch things with their hands, then you monitor the hands for contamination. And the best place to monitor it would be fingertips. We'll also use particle counters that for non-viable, but increasingly they are being introduced for process monitoring. With all the classified rooms, there's limits on how many particles in total. That is all particles, not just viable particles that can be present in a room. So that would come under environmental monitoring, but I've just included it for completeness sake. Each recovery method is specific to a certain sample type, and prior to initiating any monitoring program, you need to determine how and what to monitor. On slide 4, I stated the method of monitoring tends to determine the sampling method. For example, to take samples of the air in an active manner rather than waving a swab around, a system that actively sucks air onto an agar plate is a good sampling method. For taking samples of the prints of a production operator, having them press their fingertips to the surface of an agar plate is better than sampling each fingertip with an individual contact plate. Less time, less materials, less actions, less chance of a mistake propagating into a problem. How does one determine what to monitor and with what and when? This can be long and involved for a sterile facility or fairly basic for a non-sterile facility. What you monitor is based on a number of factors: the risk to the product, the classification of the clean room, and whether activities are happening under laminar flow or not, the type of product manufactured, be that injectables, oral, topical. Here's a map I developed for a filling room. You can see the key location of objects within the room and that the larger areas are broken down into smaller ones. It's not always necessary to break areas down into smaller zones. That all depends on how big the zones are and also what goes on within those areas. Monitoring would typically take place each designated time period using a combination of sampling techniques and rotate through the areas. Back when I was working in this role, sampling would take place once a shift or every 8 hours. So an 8-hour batch would be monitored once, a 2-hour batch would be monitored once, an 8-hour and 1-minute batch would be monitored twice. And the high risk areas might be sampled pre and post batch. So you might do some monitoring during your aseptic setup, and you might monitor, say, the filling needles once the batch has been completed. The next slide, I will expand on how to decide what to monitor with what and when. When choosing the areas to monitor with what and how frequently, you need to consider a number of factors, such as what the room is used for. So are you just washing vials, or are you filling a product or making a product? What the room classification is. Is it grade A, grade B, grade C, D, or a combination of? If the room needs to be subdivided, is it a large room? Does a lot of stuff happen in one specific area? Is there any storage in the room? Things like this. The activity in the room. So what's the machine do in the room? What do the people do in the room? Things like this. How each activity impacts on every other activity. Mostly this would be, say, operator movements, because people are the most, people are the largest source of contamination. So how does the people's activity within that room impact the sterility or the integrity of the batch? How each activity impacts on the product. So depending on what goes on in the room, if the machine breaks down or needs a service during the batch, maybe that activity impacts on the sterility or integrity of the product. So you need to consider both the actual production run itself and all the activities that go on within the filling room while you are filling product. You must think about what can be monitored to capture the said activity that may impact on the product quality. So you're in a filling room, you're looking around, you've got the area that you're monitoring in. If there's nothing specific to monitor, sometimes your plans will say monitor item B as opposed to just monitor something in the area. So you might look around and go, okay, that thing there in that part of the room, if that was contaminated, perhaps that would impact the product quality. So you would monitor that with your chosen method of monitoring, assuming it's a surface monitoring and not just an air sample. How the best to monitor these sites, and when it is best to monitor these sites. When determining your sampling plan or schedule, you may also wish to consider common production areas that may impact on the room being monitored and whether they need to be sampled in conjunction with the room being examined. For example, you may have a common sterile corridor that connects multiple rooms and leads to a storage area. So if a room is filling and the corridor is being used and there's another room also being used by the corridor, how great activities in that corridor potentially affect both of the filling rooms that are being used. For a sterile product, air and product contact surfaces are considered more critical than non-product contact surfaces and thus have to be monitored. This may also extend to personnel, equipment used to manufacture product containers, gas lines, stands, walls, whatever. Particle counting may also be required, as well as regular dummy runs using sterile media in place of actual product, the good old aseptic media fill. Each separate batch of product made includes every shift, typically needs a set of viable environmental monitoring data. Critical items such as filling needles might always be monitored as part of the batch and only post-batch, as that represents minimum risk to the compromise of the batch by your monitoring activity and maximum risk to the batch insofar as a positive recovery could indicate contamination was present the entire batch. So one thing you would have to consider here is your monitoring is a snapshot in time, and if you can't determine when that contamination was introduced, unless you can determine that by video of the batch or questioning the operators, then you have to assume worst case, which would be it was there from the start. But as part of this investigation, you'd need to investigate such things as microbe recovered, autoclave records, sterility testing results, bioburden results, and they all help you sort of target the likelihood that the microbe was there for the entire batch. For a non-sterile product, the viable environmental monitoring requirements are less regulated and it is primarily left up to each manufacturer to determine what and how to monitor. Your site may monitor the air in various production rooms once a month and also take surface samples in the room deemed to be worst case. So that might be a preparation room, or it might be the filling room that makes the product that contamination in would potentially be worse than another product. So, for example, a topical ointment contamination of that might be more serious if that ointment was used for, say, a burns patient than, say, contamination in a tablet that was ingested, because the contents of your stomach are likely to kill off whatever's in the tablet, assuming that microbe isn't resistant to stomach acid, versus slobbering on bacteria onto an open wound, which is more likely to cause further problems with a patient. For a large room, subdivisions based on size as well as placement of laminar flow hoods may be required. Regardless of the amount of sampling, the rationale behind what is sampled, how it is sampled, and how often it is sampled should be documented as part of the facility's viable environmental monitoring commissioning program. Alert and action levels. Alert and action levels exist in order to determine if the production environment is within a state of control. So our first level is the alert level. An alert level is normally based on historical data that indicates when an area is deviating from normal levels of microbes, but as yet, a risk to the product is not high. When an alert is produced, minimal actions are taken to fix the issue. So it's more or less a heads up, guys, something might be going out of whack here, so just keep an eye on it. And the more critical level is an action level. An action level is in place to show when a controlled environment is no longer in a state of control. When this level is breached, there may be a large risk to the product and thus to the end user. When an action level result is returned, a product is put on hold until an investigation is conducted to determine the cause of the action and how it may affect the product and the risk of releasing the affected batch for sale. With an injectable product, the worst case situation would be the contamination kills your patient, and that's not good, both for the patient and for you and for the company, potentially for share price and potentially for your company's continued existence. So any action level result must be fully investigated and any conclusions you draw from the subsequent investigation must be justified. Okay, why is it necessary to conduct validations of your viable environmental monitoring program? Well, without showing you can recover all or at least a percentage of microbes present, you will not be able to prove a bioload, or not be able to prove how many microbes are actually in a room or on a surface. The regulations and the auditors require you to have validated your processes and have records of this. Well-documented validations aid troubleshooting processes and out-of-specification investigations. For a production facility that has been running for years, sampling using swabs or contact plates may have been introduced before validation was mandated by the regulators. This may mean that such sampling techniques may have been grandfathered. The recovery of microbes with years of data can be shown to indicate an issue, and the no recovery could be shown to represent minimal risk to the batches manufactured despite recovery levels being unknown. So if one colony forming unit was recovered from a swab, does this represent a single microbe was picked up on the swab, or were there 20? Without validation, this is a mystery. And mysteries in manufacturing are never good. You don't want any mystery in your own processes. Validation might show that 90% of the microbes on a surface can be recovered. So with my 1 CFU and a 90% recovery rate, there's most likely you've picked up all of them there. If you had 10 CFU or colony forming units, you might recover 9. So it gives you some confidence that with the validation, the microbes you recover are pretty much all the microbes there. If it was, say, 50-50, that's when you would change your limits to accommodate whatever the regs require. Mysteries in manufacturing are never good. Validation might show that 90% of microbes on a surface can be recovered. Based on the validation and the number of allowed microbes that can be recovered, and here I encourage you to investigate the relevant guidelines and regulations. Refer to my references slide at the end of this video. Suitable alert and action limits can be put in place, and any investigations can have an informed discussion on the likely levels of microbes present based on the number recovered. So if your validation shows you recovered 50% of colony forming units from a particular surface using a particular recovery method, then you've got something to talk about in your discussion when you do your investigation into your alert or action. If you were to introduce a new sampling technique or sampling equipment today, you must make sure you develop and enact a validation study to show your method and or equipment is capable of recovering microbes from what you want to sample, and such sampling represents minimal risk to the integrity of the product being manufactured while you are doing the sampling. So there's no point, say, taking an air sample directly over filling needles if doing that is going to compromise the batch. When I validated the Merck MAS 100 air sampler, at low levels of recovery, a 1-to-1 recovery was shown to be possible by testing serial dilutions on the agar plate to be used for microbial recovery. Didn't actually test the physical recovery because we would have to aspirate the air with microbes. So what we did here was relied on the conversion tables provided by the manufacturer, which showed that I think 90 or 100 CFU, they would be able to be sampled fine. When the number of microbes go up, then the chance of a microbe actually impacting the sampling head rather than going through one of the holes in the sampling head, that increased. So the recoveries would go down, but only high numbers. And this table was put into the sampling SAP to show, okay, when you're reading the results, there's a correction factor above a certain number. So if you do recover a crazy amount of microbes on your air sample, then the actual number of microbes within the air goes up. That's all proceduralized, so you know what to do when that situation arises. As well as that, the validation tested such things as the software that ran the air sampler. So does the software do what is documented that it does? So that's a little quick presentation on viable environmental monitoring. And after this, you should now know the following: what viable environmental monitoring is and what it's used for. So basically, what's the state of the room? Is the room within control or not in control? And if it's out of control, what does that mean? What does it mean to the batch? What does it mean to your processes? And what are you going to do about it? What the different types of viable environmental monitoring are. So your air samplers, your contact/Rodac plates, your print plates, your swabs, monitoring of operators' gowns, perhaps compressed gas sampling. It's basically all the ways you'll be monitoring the environment to get data to show whether or not the room is in the state of control that you're seeking to maintain. You should also know how to determine what to monitor if required to do so. So I've given a very brief introduction to that. I may post a follow-up video on that, but if you refer to the relevant guidelines and regulations, there's a lot of good information there which details how to do it. Okay, here's most of the references I've used during this presentation. Most of it's out of my head, but I have touched on some information provided in both the USP and the PICS document. Though I've recommended specific parts of PICS PE009, I recommend that you become familiar with the entire guidance document because it's very interesting and also will help you do your work better. I have a link to a PDF version of this presentation in the video notes, and you can always rewind to something if you want to see or hear it again. I should note that me presenting this topic online does not mean you can take this and train your staff based on it. If you would like to do that, I strongly encourage you to employ me in such a role, or better still, give me a job in your lab, production or QA departments so I can use my skills and knowledge to help you and your staff on a long-term permanent basis. I'll also provide a link if you'd like to sling me $500 to $1,000 for this presentation. And if you did sling me $1,000, use this as much as you want. I hope you have found this presentation informative, and I thank you for your time.